with Alexandria Foley today, or Alex. Thank you so much for joining me, getting ready for health.
Yeah, thanks for having me. I'm really grateful for the opportunity and working with Brook Health in the remote care space. And health is one of those conferences where care delivery and access is in the forefront. So it's really great.
Exactly. And what innovations are making the most impact on nurses today that you see in your role?
I think that overall, the advancement in remote care offerings is something that's really affecting nursing in the space. So, being able to deliver care in various areas between visits, between hospitalizations, with the goal of decreasing ER utilization and readmissions is really affecting nurses, in addition to the growth and advancement in AI support. So, that artificial intelligence arm. Giving greater assistance to nurses being able to manage and reach patients in different ways.
I've seen that too. And what trends do you hope are talked about at health?
I hope that the advancement of remote care as a standard of care and the adoption of that as just the next step in the transition of care for patients follows a really natural evolution and adoption so that it becomes a discussion everywhere so that people know that it's a resource, it increases access, it assists patients in that way, and just making it a more talked about in the space in general.
Yeah, I definitely can't talk enough about it. I love using technology to scale up the people we're able to reach who we wouldn't be able to otherwise in person. Is your organization announcing any exciting news at health that will have a positive impact in nursing?
Yeah, our organization isn't necessarily announcing something that's specific to us, but there's been some movement in the remote care space with some advancement in the codes, meaning that previously remote patient monitoring was only for 16 days of data. They're looking at increasing the accessibility for the data points to a 2 to 15 data points in that 30 days, in addition to 16 and up. Also, the requirement for the monitoring minutes currently lives at 20 minutes of monitoring per patient per month, and they're looking at decreasing the minutes for that, which I really think increases the access to care for patients that become managed in that disease state so that it doesn't necessarily seem like a burden to continue on. So you can keep your finger on the pulse of the patient that way. And then you still have opportunities for early intervention and being able to be proactive in managing that disease state instead of reactive. So I'm really hoping that everyone keeps that in the forefront. And that's part of the announcements and conversation in general for health this year.
It does have a lot of exciting implications. So I can't wait to see how that works. And thank you so much for sharing about things from your perspective, Alex.
Well, thank you for having me. I always appreciate being able to talk about things from the nursing perspective with another nurse, so I appreciate it.